Hi, everybody. I'm Lauren Peretti, and I am with Housing Innovations, and I am part of the staff team at Housing Innovations that provides support for the Connecticut Balance of State Continuum of Care, otherwise known as CT BOSS. So today is a recorded webinar, and I want to thank you for taking the time to watch. We're going to be talking about what's new in terms of how CT BOSS will be monitoring COC-funded projects in 2003. So before I jump in, just here's an agenda of what we're going to cover today. We'll start just by talking real quickly, basic background, just to make sure everyone understands what monitoring is and why we do it. And then really we'll focus the bulk of our time on what's new about how we're going to be monitoring in 2023. And then we'll just wrap up with making sure that in case I didn't answer all of your questions, to give you some resources for how you can get any additional questions you might have answered. So we'll start just by talking about some background. So monitoring, when I say monitoring, what that means is basically it's an assessment that the CoC does and that HUD also does of the extent to which your continuum of care funded projects, whether or not your policies and procedures are, more or less following the requirements of your funders. And the reason that we do this is that number one, HUD requires that CoCs monitor the projects that they fund. HUD also requires that CoCs monitor that recipients of CoC funds monitor their subrecipients. And so what that means is that the agency that actually enters into the grant agreement with HUD that receives the money directly from HUD, if they pass on any of that money to a different agency, the agency that receives the money or the recipient is responsible for monitoring their subrecipients, the agencies to which they pass that money on every year. And so my firm, Housing Innovations, the firm that I work for, we monitor projects on behalf of the Connecticut Balance of State Continuum of Care, and then we also monitor the subrecipients that are funded through the Connecticut Department of Mental Health and Addiction Services. And we do that not for every project every year. We just do it for a subset of projects. And this year we will be monitoring 4 CoC rental assistance projects. So we'll talk about this a bit later, but it's less monitoring than we've done in the past. So why do we monitor, right? What are we trying to achieve when we monitor? So the first thing is that, the rules for the CoC funds are really quite complicated. And we know that you all are incredibly busy doing the very important work of ending homelessness in your communities. And we want to make sure that your time and energy is focused on that critical work. And we want to do everything that we can to help you understand all of the complicated rules, all the things that you're required to do by HUD, the federal agency that funds these projects, by the state of Connecticut, and then by our local continuum of care. And so we want to make it as easy for you as possible to understand what those requirements are and to follow those requirements. And we also want to make sure that when HUD comes out and monitors, that your projects are well prepared for those visits and that you're not going to have any issues when HUD comes out. In part because when HUD comes out and monitors for certain kinds of findings that they have, they can actually recapture money, right? So they can take money back from the project. So for example, if you expend money on an ineligible expense, they will most likely require you to repay that money. And so we don't want to see that happen. We want to make sure that all of the resources that come into the Balance of State Continuum of Care to help people experiencing homelessness stay in your program so that we can help those folks to obtain housing and to stabilize in that housing. And then finally, we also at CT BOSS use monitoring as an opportunity to really identify what are the areas where people seem like they really understand the requirements and we're all good, and what are the areas where folks are really struggling and that we may need some additional training or technical assistance or tools that you guys can use to help you get more aligned with what the requirements are. So as I said, today really is going to be a brief overview of what's new, but we do have on the Connecticut Balance of State Continuum of Care a much more in-depth webinar on monitoring that we did and recorded last year. The link to both the slides from that webinar as well as the recording are here on this slide. So if you're new to monitoring, if you've not been to one of these webinars before, if you've never been actually had one of your projects monitored, you may want to watch that more detailed webinar where we really go through kind of soup to nuts what the monitoring process looks like and what you can expect. So, so the basis for what we do in monitoring is the CoC Monitoring Guide. So that guide really outlines all of the standards that we look at when we monitor. So we like to say it's an open book test, right? There are no surprises when we come out to monitor. That guide, there's a link to it here on this slide, is posted on our website, www.ctboss.org. So you can always go and check out anytime what the things are we might look for when we're monitoring. And that guide really also hopefully serves as a resource for you guys, because there are so many different requirements from the various funding sources, and it really attempts to pull all of the most important things together into one document. And then it also provides citations, right, for what's the basis for this standard. Is it a CT BOSS requirement? Is it a federal requirement? And then it links to all sorts of tools, forms, resources, etc. So hopefully it's a resource that you guys find helpful. So, so now I'm going to talk about what's going to be new about monitoring in 2023. So the first thing is that we are really doing less monitoring than we have done in recent years. So I said this before, we are only going to be monitoring 4 projects in 2023, and all 4 of those projects are going to be projects that are funded through CoC projects, but that are funded through the Department of Mental Health and Addiction Services, or DMHAS. So it's all subrecipient monitoring on the DMHAS CoC rental assistance projects that we're going to be doing in 2023. And the upside of that, right, is the less time we spend monitoring, the more time we have to provide resources for you guys, training and resources to help you comply with all of the requirements. And so this year, for example, we are excited that we are going to be working on an onboarding training series. We know that your agencies are really struggling a lot with staff turnover, and every time you have somebody new come onto your team, you've got to orient them and onboard them. And so we'll be starting to release recordings, do live webinars that hopefully will be helpful to you as you onboard new staff onto your teams. So now I'm going to walk through, and there really aren't very many changes in the guide this year. So for folks who've been through this before, you're not going to see a lot that's new. We know that COVID has really made it clear to all of us how very important it is for our programs to be prepared for unexpected emergencies and to be able to really pivot and respond rapidly to those emergencies and continue to provide the absolutely critical life-saving services that all of your projects are providing. And so we've added this year a new series of questions in the monitoring guide about emergency preparedness and response. And on all of the things that I'm about to talk about, it's going to be a self-assessment. So it's an opportunity for you to look at your own operations and to say, yes, we're doing this, no, we're not doing this, and to identify if there are things that you're not doing, maybe some areas, potential opportunities to introduce some new strategies to make sure that your programs are prepared and able to respond quickly to any kind of emergency. And so you'll be asked as part of the monitoring process whether or not you've got an emergency and disaster preparedness and response plan, and in particular, whether or not such a plan includes a number of things that are outlined on this slide and the next slide. So the first one of them is a risk assessment to identify what are the potential crises that are most likely to happen in your local community. Obviously, that is, very location specific, right? We're not in California. Earthquakes in Connecticut are probably pretty rare. We are in Connecticut, a coastal state, so flooding, for example, might be the kind of emergency that is more likely to happen for you all. So that's the first thing. The second thing is whether or not you've got a plan to identify, depending upon what type of emergency it is you're dealing with, who are the relevant partners that you need to be coordinating with, and how you're going to make sure that that coordination happens. So that might be for an emergency like COVID, right? Obviously, public health authorities, really kind of for any emergency, your emergency management people at the state and local level, et cetera. It also asks you whether or not your plan includes protocols to minimize the impact of any loss and to ensure that the most time sensitive and critical services that you offer can either continue to operate uninterrupted by the emergency, or to the extent that that just simply is not feasible, can get back up and running as quickly as possible. We know that you all are really providing certain kinds of services that are absolutely critical for folks experiencing homelessness, and want to make sure that you have a plan to continue those services or get them back up and running quickly. And then finally on this slide, always in a crisis, communication is super important. So making sure that your plans include information about how you're going to communicate with your staff, with your clients, with your volunteers, if that's an important resource for you, with your board, with your funders, with partners in the community, with the public, right? So that the public knows when you're going to be open, how they can get services, et cetera. So also you'll be asked to just self-assess still on whether or not your plan includes steps and a timeline after the crisis is over to assess how did it go. Is there anything you want to do differently next time, and to make revisions in your plan accordingly. And then, of course, every plan is only as good as the extent to which our teams know what the plan is and can execute the plan. And so that there's some protocols in your plan for how you're going to inform your team about what the expectations are of them, so that they can be well prepared to execute the plan quickly in the event of any emergency. All right. So the next set of things is very much related and is also entirely self-assessed. So we'll be asking you whether or not your project has incorporated certain strategies into your approach around infection control and response to any public health emergencies. Now, we know that your projects have done an amazing job keeping very vulnerable people safe during COVID, and that you all have learned, I'm sure, a ton about how to do that effectively. And we also know that COVID is going to be with us for the long term, and that there's likely to be other kinds of public health crises. And we want to make sure that we're taking all of that good learning from COVID and really institutionalizing it, so that the memories don't fade, and so that we can be as well prepared, if not better prepared, the next time such a public health crisis happens. And so a lot of these things are pretty similar to the things that we just talked about in the last series of slides, but want to make sure that your, again, self-assessment, that your approach includes these things, right? Maintaining your operations whenever possible to ensure the continuation of those critical services, coordination with your local public health partners, making sure that you're monitoring the situation, right? We know that in an emergency, things change rapidly, as we saw during COVID, that you've got a strategy in place to monitor that situation and to distribute updates about critical information to your staff and clients as things change, and that you're adjusting job duties. You all did this during COVID, making sure that the staff that are the most vulnerable, for example, are assigned to less risky tasks, and that where more coverage is necessary, that you're shifting staffing around as needed. And of course, this cannot be emphasized enough. These are always difficult jobs for your teams, and whenever folks are dealing with an emergency on top of homelessness, right? Making sure that there are self-care resources so that you're taking care of yourselves and your team and avoiding burnout as much as possible. So, and then these are just the last few things that we'll be asking you about. So making sure that your strategy includes risk reduction protocols, symptom screening, and testing in accordance with whatever the latest guidance is from public health authorities, that you've got ongoing efforts in place, not just for COVID, but for all different kinds of vaccines that are so important to folks experiencing homelessness that we know have increased vulnerabilities for all sorts of infectious diseases, that your strategy includes efforts to build vaccine confidence, not only among your participants, but also among your staff, because when staff get infected with something, that is also a risk for our participants. And then finally, that you are coordinating with your public health partners to make sure that folks experiencing homelessness that are highly vulnerable are on their radar and prioritized in their vaccination rollouts, and that hopefully they are providing vaccinations with your help at places that are convenient for your folks, ideally whenever possible on site at your programs, but I know that that's not always feasible. So, okay. So this actually is not new, but is related to something that is new that I'm going to talk about in a moment. But just before I do that, a quick reminder that under the Violence Against Women Act, folks that are experiencing domestic violence, dating violence, sexual assault, stalking, human trafficking, those folks that need to transfer to a different housing unit for a safety reason can use the Connecticut Balance of State Emergency Transfer Plan. That plan is linked on this slide. And that option is available to folks if they reasonably believe, that they are at imminent risk of violence if they were to remain in the unit where they are currently living, or if they have been the victim of a sexual assault that happened in that unit or on the property where they live within the past 90 days. So that has been in place for a number of years now. That is not new. What is new is a requirement that was passed recently, I believe it was in September, by the steering committee, that requires all of our CANs and all of our CoC and ESG funded projects to notify people of what their emergency transfer rights are, right? Because if people don't know they have the right, they won't know to ask for a transfer when they feel unsafe because of domestic violence in their unit. And so we want to make sure that we are informing people of this, regardless of whether or not we think they may be dealing with some sort of domestic violence situation, because we don't always know, right? There might be people who have had these experiences that haven't disclosed, and we don't know about it. So we want to notify people universally of their rights. And we have created a really, hopefully, user-friendly, brief description about what an emergency transfer is, and how people can, who's eligible, and how people can access an emergency transfer. And so the requirement is that you give that notice to people when they apply for assistance, which is really, done at the CAN level, when they enter your project, and once a year when you recertify them for assistance if they're with you for longer than a year. So this next thing that we're going to talk about is actually still pending at the steering committee as of this recording, but we do anticipate that the steering committee will be adopting a policy on this in early 2023. And it's similar to what we just talked about, right? We know that folks have the right to file a grievance, but if they don't know that they have that right, they won't exercise the right. And so we want to make sure that projects and coordinated access networks, CANs, are providing people with a notice about what their grievance rights are and how they can file a grievance, and that you are helping people to understand what those rights are by reviewing those rights with them. And again, at the same times that we just talked about under emergency applications. So you would do that when someone applies for assistance, when they first enter their project, and at least once a year. Probably most of you will also do that at annual recertification. Once this is finalized by the steering committee, we will circulate the notice that we've done on this for you guys. That'll be sent out to the CT Boss email list. If you're not already signed up for the list, just go to www.ctbos.org, and right on our webpage, there's a place where you can sign up for our emails. And everything, of course, is also always posted to our website on our resource page on our website. All right. So also coming soon, we are working on revising the Participant Bill of Rights. That's been in place for a long time in CT Boss, a requirement that you provide that Bill of Rights to folks. We're making it a lot shorter. I hope that'll be good news for you all, and hopefully easier for people to understand and easier for you to go through with people. And we will obviously notify you when that has been formally, the simpler version has been formally adopted by the steering committee. And so what that basically means is that there will be, starting in early 2023, 3 notices that you are now required to provide to everybody in your project. So the revised Client Bill of Rights or Participant Bill of Rights, the notice of people's emergency transfer rights under VAWA, and the notice of people's grievance rights. So to try to make it as easy as possible for you all, we're creating a acknowledgement of receipt form, right? So that you can have clients sign off to say that they received all 3 of those things. And again, once the steering committee approves all of these things, that form will be posted to the CT Boss website on our resource page. And I know many of you, instead of using paper forms, have moved to using your electronic health record system to have people sign off on things. That's totally fine. You can use whatever format you want to have people sign off. We'll just look for there's some sort of sign off when we come to monitor. So you can opt to use the form that we are providing, or you can opt to document that you have given people each of these 3 required notices through whatever mechanism works best for you and your programs. So, okay. So we have also updated the participant chart documentation tool to include these new requirements. And for people that are new maybe and not familiar with that tool, it's linked here on this slide. And basically what it does is it walks through, for each type of CoC funded project, what are all the documents that you are required to have in participant charts, which is what we'll look for, some subset of those things. We don't look for everything every time we monitor, but if you have all of those things in your chart, you'll be in very good shape when we come out to monitor, or when HUD comes out to monitor. So, and then this next slide really just shows a screenshot of an excerpt of what that tool looks like. So you could see for these different types of projects, you know, on the top, it shows what type of project, and then underneath it shows what the document and which type of project that the document is required for. All right, so Demas wanted to make sure that we reminded you guys about this record retention requirement. So basically, for all of your projects that receive CoC funds, the federal government requires that you maintain all of your records pertaining to those projects for a minimum of 5 years. The requirement for eligibility documentation is actually a little bit longer than that. HUD says that you've got to maintain eligibility documentation for 5 years after the end date of the last grant period under which the participant was served. So the easiest way to think about that is probably if you maintain it for 7 years, that is kind of a safe rule of thumb. And Demas really advises that you maintain all records for a minimum of 5 years from the end of the relevant grant end date, and that Demas suggests that you maintain your eligibility documentation in perpetuity. So, okay, so this next thing is actually not a change to the monitoring standards or the monitoring guide. It's really just a little tweak to our process. So most of you are doing this anyway when we come out to monitor. It's super helpful for our team to be able, when we're looking at somebody's chart, to be able to look them up in HMIS and be able to see in HMIS when they entered your project, if they exited, when they exited your project, and also just what other projects have they been in, you know, when were they in shelter, if they were in your rapid rehousing project, did they exit to a PSH project, when did that happen? So we are going to be asking this year that for all agencies to give us HMIS access, just time limited, read only, and you can still use your electronic health record for us to review your case notes, your service plans, for all the documents that you're going to review. It's totally fine if you still want to do that through your own agency's electronic health record system. We just want to, in addition, be able to see the project entry and exit, the pattern of, you know, how people have moved through the system, just because it's helpful for us to understand the story as we are reviewing somebody's charts. So, all right. So the last set of slides here really talk about a change in the HUD monitoring process. So HUD recently released a notice that changes how they decide which projects they're going to monitor. So they call that their risk assessment process. And for those of you who, I think the notice is 100+ pages long, for those of you that don't consider that cozy fireside reading, I've summarized what that notice says on these slides. But by all means, if you'd like to read the whole thing, it's linked here on this slide. So basically, these are the factors that HUD is going to use to decide whether or not they're going to which projects they're going to monitor. So if any of these things apply to you, it's more likely that you get selected for HUD monitoring. So the first is inaccurate and or untimely reporting. So the main thing there is going to be get your APRs in on time and make sure that they are correct. The second one is if you are a recipient and you've got multiple subrecipients on a project, that's going to make it more likely that that project gets selected for monitoring. The third thing is if HUD knows that you have had a lot of staff turnover, that is going to make it more likely that you get selected for monitoring, or, although I think a lot of programs have had a lot of staff turnover. So I think that's probably going to be a difficult one for them to, they're not going to monitor every project that's had staff turnover. The size of your award, this is also a factor we use in selecting projects for monitoring. So if you've got a very big award, HUD is very specific about this number. So they say if a recipient of HUD funds has a cumulative grant award, so all of your projects together, of more than $2.17 million, that's going to make it more likely that you get selected for monitoring. And then if you've got any leasing or rental assistance awards that are greater than $400,000, that will make it more likely that HUD is going to come out and monitor you. And then the last set of factors here that they are going to use, if you're not drawing down your funds in ELACs at least quarterly, that's a risk factor that they'll look at. If they've been out before and you had some, pretty significant monitoring findings before, they're going to look at those things when considering who to monitor. And then if you've not been monitored in the last 3 years, that's another risk factor they'll look at. If they've asked you for some sort of fiscal audit, and you've either not provided that fiscal audit, or there are audit findings on that report. And then finally, if your program has had any kind of negative media exposure, or HUD has gotten any complaints from client, staff, elected officials, people in your community, those are factors that they will consider. So lastly, we really are here to help you guys. And if you've got questions about anything I talked about today, or you can't find something that you're looking for, don't hesitate to reach out for us. If you've got ideas for trainings or resources that you'd like to put in our hopper to develop for you guys, always let us know that stuff. And then don't forget that if you're new to monitoring or you just need a refresher, there is a more detailed monitoring webinar available on the CT Boss website, www.ctboss.org. It's on our training page. It goes into a lot more detail than what I covered today about monitoring. So this slide has my contact information. It has the CT Boss Gmail address information where you can reach anyone on our team. And then if you've got a question specific to DMIS monitoring, feel free to reach out to me or directly to Alice Minervino at DMIS for any of those questions. So that's all we've got for you today. Thanks for watching, and don't hesitate to reach out always if we can be helpful. Have a lovely day, everybody. Take care.